Thank you all for joining us this afternoon for Now This and a conversation with presidential candidate Andrew Yang, fresh off the Polk County steak fry stage. I'm Sue Dinsdale. I'm the Executive Director of Iowa Citizen Action Network, and we've been working with the Main Street Alliance for about the last 11 years. And it's so perfect that we're having it here in this spot, because one day when I was starting to organize and find small business owners, and we were organizing around healthcare, I walked by a little shop about a block away, and there was a t-shirt in the window that said, "America, only the insured survive." So I went in and visited with the owner, Mike Draper, and ended up facilitating a trip for him to DC to testify before Congress about the importance of healthcare for small business owners. So that is the focus of our conversation today. We may hit on a few other topics too, but we'll start with some healthcare questions.
Well, that's an experience I can relate to very directly. I ran a small business, and healthcare was one of our biggest expenses. And the worst part about it is that all of the incentives attached to it were very much the opposite of what you'd want.
Right.
Where if you hired someone, then you had to factor in healthcare expenses. If you had to consider whether someone was a full-time employee or a contractor, all of a sudden when they turned a full-time employee, their healthcare expenses would be much, much higher, which is the opposite of what you'd want. Like, you'd want to encourage a business like mine to hire more people. And then the prices only went in one direction, ever. Like, you never get good news. You're like, good news, your health insurance got cheaper. It's like, why have we never actually heard that? And perhaps the worst part was that you had to have periodic, really difficult conversations with your staff.
Right.
Because you're like, hey guys, insurance costs went up again, so we're gonna cover this, but we'd want like you to cover this, and like, you know, so that stinks. And then when we had to actually change coverage, then it became this massive process, because people obviously have very strong feelings about their healthcare coverage. And there was a big part of me that just thought, how ridiculous is this? Like, I'm running a business, in my case it was an education business. I should not be like giving myself brain damage trying to figure out all these insurance plans. And then I should not be having these conversations with my workers that end up being very personal, because some of them have health situations, some of them have family members, some of them are in family planning mode, like et cetera, et cetera. And I just thought to myself, this entire set of obligations falling on employers this way is not what we should want as a country, because we should be encouraging businesses to hire people right and left, to treat them well, to give them benefits. We should be encouraging people to change jobs and start new businesses if that's what they want. Right now, our health insurance system keeps people locked in place. There's even a technical economic term for it. It's called job lock. There are millions of Americans that are in job lock right now,
Exactly, yeah.
where they're on the fence as to whether this is what they should be doing, but then they think, well, I can't leave because of my health care. How many of you know someone who's in that situation, or yourself?
Yeah.
We all do. And I'm all for people staying put if that's where they belong, but I'm not for people staying put because they feel like they have no choice. And economy-wide and society-wide, dynamism is generally a positive thing. Like, people starting new businesses is an incredibly positive thing. And I'm 100% sure that our healthcare costs right now are stifling people from starting businesses in many, many contexts here in Iowa and around the country.
And we do find that when we're talking to small business owners around the state, that it's a big issue. It's the biggest issue for them.
It's one of the things that would keep someone from taking a risk and starting a business. And as someone who has done that, it's really difficult. Like, the last thing you want to do is like add in another factor of difficulty and cost and anxiety, and frankly even relationship stress, where if you're a person who, let's say, like, I'm married and have 2 kids, like, if you decide to make that change, that's not just you, and you have to turn to your partner or family and say, hey, I really want to start this business, but we rely upon my job for healthcare coverage, so how about we cut back in that? Or how about, we find some other way? I mean, like, these conversations are happening every day in this country. And imagine if it was a different type of conversation where it's like, hey, I want to start this business, and then healthcare was provided by our government in the public sector, and then you'd get rid of this giant obstacle. Right now, there are so many statistics in America that are, to me, very, very discouraging. But one of them is that the rates of business formation and entrepreneurship are at multi-decade lows in this country. And so we talk about America as the home of entrepreneurship, but we're making it much, much harder for people to actually start businesses. And this is doubly true for young people. If you look at business formation rates for younger Americans, they're also at all-time or historic lows. And that's something we have to turn around.
Very good. Well, we have a great group of people here, and I know they have lots of questions for you. So would you like to start?
Yeah, I'm Kylie Roach. I'm a student at Drake University into my senior year. And something that I just noticed as a young woman is that there's not a lot of access to basic contraceptive care, especially in low-income communities. So my question for you is, how, as president, would you make basic contraception more available?
I am in the Medicare for All camp, that we need a quality public option. And if you had a public option, I'm not in the camp that you should get rid of all private insurers immediately. The goal of the public option should be to demonstrate that it is a superior option to what else is out there based upon cost and coverage and efficacy. But if you had a public option, one of the first things you'd be doing is making basic contraceptive care available to anyone who wants it. And I say this with 100% confidence because providing quality contraceptive care is a massive economic boon and a money saver, because you're helping women make plans about their professional lives and their careers, and that actually adds a lot to your economic productivity. I mean, women are, in my mind, the greatest underappreciated and untapped resource here in this country. And you think, it's like, well, what do you mean? Like, women are already, it's like, no, they're not. I'm totally sure of this because I've seen all the obstacles that are presented to women at every step of the way in the workforce and in trying to start their careers or businesses. And having quality contraceptive care should not be on that list of obstacles at all. From the public perspective, access to quality contraceptive care would pay for itself many, many times over.
And kind of following along on that line, a woman's right to choose what happens with her body. Are you?
I am for women's reproductive rights as fundamental human rights. I would protect them at the highest levels. I actually think it's embarrassing that male legislators have an opinion on this. We should just leave the room, let women figure it out, come back, and then the women would tell us what they wanted to do. I have a feeling I know which way they would decide. But for now, in the absence of that situation, then I would champion women's reproductive rights at the highest levels, including adding Supreme Court justices, because there's nothing in the Constitution that says we need 9 Supreme Court justices. We all just remember it as being 9 because it's been that way for a while. But if you look back at our history, there have been 5, there have been 11, there have been 12. So I'm all for protecting women's reproductive rights in the most fundamental ways.
Thank you.
I'm Kevin Peterson. I live in West Des Moines. I have a lifestyle wellness company, Peterson Holistic Services.
Oh, good for you. Give it a plug. Go ahead. Talk about it more.
Peterson Holistic Services in Urbandale. And I've been a health and wellness provider for over 10 years. And I've gone through some health transformations myself. I lost 150 pounds over a number of years.
Wow.
So I know something about health transformation, and that's really something this country really, really needs. And as a provider, I really believe that the heart and soul of that transformation is clean nutrition and nutrition education, functional fitness training, and things like that. And so what I want to know from you is where in your platform, where in your imagining of this healthcare system are those truly preventative measures of nutrition and functional movement that really are at this heart and soul of health. Carrying on health and preventing disease.
I love this question so much. I want to shake your hand. That's you hit the nail on the head in so many ways. And I was talking to Mark Cuban. You know who Mark Cuban is?
Yep.
So Mark Cuban said to me that one of the big problems in healthcare is food and nutrition. And that if you're building up essentially all of this health debt, if you will, by eating crap, and the rest of it, it ends up costing our society in both human and economic ways. And so the question is, how do you go earlier in the food chain and make it so that people have better nutrition, better education about nutrition, better access to decent, healthy food instead of just the crap on the corner? And the crap on the corner, we all know, is much, much cheaper. So if you're in any kind of economic exigency, the easy thing to do is just to be like, well, it's freaking dollar menu time.
Yep.
I'm actually staggered at how much fast food you can buy for a very low amount of money. It's like the dollar menu blows my mind. I don't indulge the dollar menu myself very often, if at all. Anyway, I digress. So there are some very, very important things that we can do to help move society in the direction you're describing. Number one is, as you all know, my flagship proposal is to put $1,000 a month into people's hands, which, if they had the economic boot off of their throats, then they could make a choice to pursue eating more fresh food, fruit and vegetable, less fast food, and then some of those retailers and providers would actually go to their neighborhoods. Because we know right now, if you're a Whole Foods, you're not going to go anywhere near, some poor neighborhood. You're like, they can't afford my stuff. But then if more people can afford your stuff, then maybe you do end up trying to get there. So that's big move number one. Big move number two is that right now we have both an economy measured around productivity and a healthcare system that's designed around cost and revenue. And both of those things are leading us in the wrong direction. So one example I use all the time, GDP's at record highs, but our life expectancy is going down. So which of those two things do you listen to? Obviously, your life expectancy, because what good is more productivity if you're dying? And so what I would do is I would take GDP and say very plainly, look, this measurement is 100 years old, really out of date, increasingly useless, increasingly low relationship to actually how we're doing, which is our health, our life expectancy, our wellness, our mental health and freedom from substance abuse, our childhood success rates, our clean air and clean water. I would make those the new measurements of the economy. And then all of the energies that are going towards trying to increase our GDP instead would be trying to increase our well-being. And then you would look around our communities and say, wow, a lot of people are eating very poorly. A lot of people could be made much, much healthier. And the great thing is that it would, again, save us a ton of money. Because if you have people who are developing diabetes and showing up for treatments at earlier ages, that's incredibly expensive. And we bear that cost not just in the treatment, but also because those people become less productive, they become sick earlier, they have problems. So there was one study that showed that if you were to alleviate poverty, you would increase GDP by $700 billion just on the basis of better health outcomes and better education outcomes. Because you'd have people healthier longer, and then guess what? They would get more stuff done. So the big move is to change our actual measurements to correspond to the work you're doing. If you can imagine Des Moines getting a health and wellness score the same way it's getting sports scores on the news. Every quarter it'd be like, hey, how are we doing this quarter? And it'd be like this. And then, and then I have a feeling we could grow your business a great deal. Because of the people that need or should be using your business, what percentage actually pursue this regimen that we're talking about? Probably 2, 3, 4, 5%. It's very, very low.
Yeah, I think a lot of the barrier is really in, right now, the insurance coverage. I think people are wanting, and they really crave this information. They crave this guidance, especially, I think the younger generation is going to benefit from this conversation because they're going to hear about this. They're going to hear about the value of nutrition, the value of clean eating, and all of those things. But it really is, the folks that are in their mid-30s into their 50s that have gone through this boom of manufactured foods, and they have to go through a process to get themselves out of it.
Sounds like you went through that personally.
I did, absolutely. I absolutely went through that personally, and that's really what I work to take people through is that process.
It's great. Good for you.
Yeah,
You're such a role model.
Thank you.
And then the third way we make it so that your work becomes the mainstream is you go into the guts of the healthcare system. Why are we spending 18% of our GDP to worse results than other countries? It's because our healthcare system is not actually designed to make us healthy. It's designed to generate revenue. No, you have device companies and drug companies and health insurance companies that all have record high profit margins. They're profiting at unprecedented levels off of us, really. It's become this crushing weight on our economy and society. And so you have to try and change the incentives. And I'm inspired by the results at the Cleveland Clinic where doctors just get paid a flat salary. And then they all of a sudden think you need to prescribe fewer procedures and whatnot because they don't get paid based upon how many procedures they do. And their health outcomes are better than other hospitals because right now we're over-treating a lot of stuff. We're also over-treating things because people don't want to get sued. And you can only essentially get sued for not doing the thing. You know, it's like, oh, I decided you didn't need it, so then if something happens, I could be sued, so I guess I'm going to say you need it. And so you wind up building up all this cost. If you could change, imagine a hospital's incentives being tied to just how healthy people are locally, then you know what that hospital would end up investing in? His service.
Right.
Because it would be like, you know what we need to do? We need to educate people on nutrition. We need to get people better food. We need to try and... The ideal design of a hospital would be a hospital designed to keep people from not showing up to that hospital. But right now, if no one showed up to that hospital, a hospital would go out of business like that. Because the hospital needs to have people coming in and then doing things for them to get paid. So these are big changes, but they're more feasible than you all think. Or than when you were watching this, you think. So number one, everyone getting $1,000 a month, it sounds like a fantasy. All it takes the majority of Americans saying we're going to do that, and it's done. They did it in Alaska. It's been in effect for 40 years. All you need is a majority of us and then a majority of Congress to say, let's start giving people $1,000 a month, and we can do it. Definition of GDP, all it takes is President Yang going down the street to the Bureau of Economic Analysis and saying GDP is 100 years old, it's really out of date and dumb, we're going to update it with these other numbers, and then I will present these numbers to you all at the State of the Union every year. I mean, nothing can prevent me from doing that. I mean, it's just, here are the new numbers. You know, and 8 Americans are dying of drugs every hour. That's horrifying. So we're going to try and get that down. You know, you have like real problems, and you present them. And then the third one is the hardest, which is getting the healthcare incentive, the healthcare system's incentives tied to our health and wellness. That one is not easy. But I'm happy to say that there are promising experiments that are happening in that space right now around something called value-based medicine, where like if you're producing value with patients, then you get compensated. And public option is a huge step in that direction because as soon as the government is then assuming the cost for tens of millions of Americans, then all of a sudden the government's incentives are to try and get you healthier. And then that would end up mainstreaming a lot of what you're doing for your customers.
Hi,
Next up.
my name is Jessie May, and I'm a birth doula here in Des
Good
Moines.
for you. That's incredible.
Thanks.
It's okay. So this might be too much information, but we used a doula.
Yay,
And
that's awesome.
and we loved her. And as the husband and father, I loved her.
That's what all the husbands say too. They say, yes, thank you so much.
Doulas are amazing, and this doula in particular, I'm sure is amazing. What's your name? Go ahead. And,
Jessie May
So Jessie May, the doula, lives where?
in Des Moines, here in
In Des Moines. So if you're anywhere near Des Moines and you need a doula, it is Jessie May. All right.
Oh, thank you. Okay, my question is directed towards this. Our nation is struggling to keep its mothers healthy, safe, and alive. And disproportionately, our Black mothers, our immigrant mothers, and our uninsured mothers suffer at rates 3 to 5 times that of white women in this country. When president, what steps will you take at the federal and state levels to decrease the maternal mortality rate and increase maternal health as a whole in this country?
This is very personal and important to me. I mean, I've got 2 young kids myself, and I have many friends who've struggled with various elements of maternal health. A lot of it's socioeconomic. If you are in a poor area, poor neighborhood, you end up having worse or non-existent prenatal care, prenatal nutrition, vitamins leading up. In extreme cases, you might have a drug problem, and then sometimes, the child unfortunately is born inheriting those problems. But the statistics around this are really, they should be shocking to Americans because our life expectancy or the infant mortality rate is a total aberration relative to other countries, other developed countries. If you look at the list, it's like, other developed countries and then the United States. And a lot of that is because of the economic inequities that you point out, that a lot of it's because of black women, black moms, immigrant moms don't have the resources they need. So we need to give them the resources so they at least have a chance to have the baby develop in a healthy way. And then we need to tie these institutions' incentives to having an infant mortality rate that is, frankly, within international norms or standards. And this happens immediately after birth, but I think it's crucial. There are only 4 countries that don't have mandatory paid maternal leave for new moms: the United States of America, Swaziland, Lesotho, and Papua New Guinea. I would suggest this is not a list we belong on, but it just goes to show how pathologically anti-mom, anti-family this country is. I was shocked myself when my wife gave birth, like just how ridiculous the process was against her, it felt like, at every turn. And so I feel very passionately about this. My wife decided to pursue natural childbirth with a doula, so I applaud what you do for a living. And we had a tremendous experience with that and would recommend it to others. Obviously, it's very personal, whatever the mom wants to do in terms of how she decides to pursue giving birth, but that worked for us.
You know, you talked about the paid family medical leave and childcare, and those are issues that you don't normally think of small businesses being excited about, but they are. And there are plans out there. In fact, in Iowa, there are kind of 2 opposing plans. We have a couple of our congressional representatives who are signing on to the Family Act. And then we have our senator who wants to rob future Social Security earnings to pay for paid family medical leave. So how would you pay for that? And then what would we do about like childcare deserts or the exorbitant cost of childcare? But we want the childcare workers to be paid because they're probably the most important people in a child's life aside from their parents.
So this is another example of us shooting ourselves in the foot in terms of how we think about expenses and costs. It is very clear from the data that paying for maternal leave pays for itself. It pays for itself in terms of the woman staying in the workforce. I'm sure it pays for itself in terms of child development, the rest of it. And I do not think that it should be necessarily, though as someone who's run a small business, I was happy to pay for things in that direction, but I actually think it should not come off of the shoulders of the small business because it's society that's going to benefit. Society benefits if that woman is healthier and able to return to work in a certain time frame. Society benefits, obviously, if the kid is developed in positive ways.
And don't forget about the fathers, too.
And the father. I mean, ideally, you'd have maternity leave, yes, but you'd also have shared parental leave, and then the parents can divvy it up however best works for them because different families have different situations. But that, to me, is very much a federal responsibility. It should not be coming out of the backs of employers. Because the tough part is if you're a small business, you want to do the right thing, but then all your financial incentives are to do the wrong thing. It's terrible.
It is.
And then as a person, you're like, well, I'm going to try to do the right thing here. But it's like, wait a minute. Like, why are we trying to make it so hard for you to do the right thing? Like, as a society, we should do the right thing, and then you should focus on your business and not have to make difficult human decisions all the time.
Thank you.
As you can tell, I lived it. And I was just like, this is such a bizarre system.
And it's interesting, in Iowa, when I talk to people about paid family medical leave, they don't even know what I'm talking about. It's not an issue that's really risen up. And so I think we all need to work on making that an issue in the next election.
And this is the big transformation. If you change your economic measurements to be human progress, then all of a sudden child daycare pays for itself. All of a sudden maternal leave pays for itself. That's really the trap that this country's gotten itself into, is that we've started to see everything as an economic input and that everything has to be about capital efficiency. And then you have very ridiculous outcomes from that. It's like, hey, you're going to lose your job in a coal mine, maybe we'll turn you into coders, even though that makes 0 sense. But the only way you would even think that's possible is if you just get brainwashed that economic value is the same thing as human value. If anything, we have to go the other direction and say human value is economic value, and then all of a sudden, childcare, education, nurturing, caregiving, it all becomes investments instead of expense lines. that has to be the direction we go. If you know anything about my campaign, you know I'm about trying to evolve the 21st century economy, and a lot of the capital efficient jobs are going to get usurped by machines, very, very clearly. I mean, there are self-driving trucks on the highways right now, and driving a truck's the most common job in 29 states. So, you know, what is the path forward? The only path forward that actually wins for us is if we change our economic measurements to be human flourishing and then move in that direction as fast as possible.
Thank you. I think.
Hello. My name's Jake. I am a current medical student here in Iowa, but I'm originally from a medically underserved community over in Washington State. And my question has to do with medical education. A lot of myself and my peers are going to staggering amounts of debt in order to afford
$200K, easy.
$250,000 up to...
Is it more?
Yeah. Combining undergrad debt along with that, leading into almost $500,000 for some of my friends that I know.
I was trying to be conservative, but it's more like $300,000 or $400,000.
It seems like a figure just now, but I know that from going into graduation and looking for a residency position or looking for a job, going and so forth, that is a weight that a lot of myself and a lot of peers are going to be feeling, even though people like us would want to go into serve some of these communities, like these medically underserved communities that we're from.
I have such strong feelings about this. Continue.
My question to you would be, how, in your first days as president, would you make graduate medical education more affordable and accessible, especially those from low-income families, so that they can go back and serve the communities that they came from?
I love this question so much, and it's so profound. So I've got a question for you that no one ever thinks about. Why are there too few doctors in the United States of America? Is it because there's a shortage of young people who want to become doctors? No. It's because we've artificially constrained the supply of doctors for decades. We've made it incredibly expensive to educate doctors, and we've said, guess what? We're not going to increase the number of slots. This is essentially the AMA, the medical lobby, artificially constraining supply so that they can keep earnings very, very high. And the cost of education obviously has skyrocketed. It sounds like you're going to owe, several $100,000. I owed $100,000 myself in school loans, so I know how onerous it is. And so here's what we do. Take smart people who want to be doctors and say, great, you got into med school. There are a lot of other excellent people that could have been doctors, but we're going to shut the door on them. And then if you get into medical school, we're then going to throw hundreds of thousands of dollars of debt on you. And maybe you wanted to be a family doctor or a primary care doctor in an underserved area, but we're going to set the incentives up so that that would actually be very, very difficult for you. Because you have this massive debt load, and if you go to that area, you're going to make less money in a more difficult environment. So then when you're in training, then your incentives are to specialize and do something more lucrative, not primary care, not family medicine. And then after you specialize, then your incentives are to go to a densely populated urban area that can then pay you and your specialty a lot of money. So I made a joke at the last debate that I'm Asian and I know a lot of doctors. Those are true facts. I am Asian and I do know a lot of doctors. And they all lived versions of this. They showed up to medical school, they had a range of incentives, and then you're in the system and you're like, wait a minute, I owe how much? What? It's like, I guess maybe I should stick around and get that fellowship in, anesthesiology, dermatology, And then you're like, okay, now I've got this thing. If I go to the coastal city, I can make a killing. I guess that's my move. And those are the incentives we've set up. So what do we need to do? First, in the short term, we should forgive a lot of the medical school debt for someone who decides to go to an underserved area. Think about 30% of the country is a primary care desert, where people can't access primary care doctors. The big thing we need to do, though, we need to break the stranglehold of the medical lobby on treating patients. Because the fact is, in this era, if you have a nurse practitioner or a primary care specialist who's supplemented by AI, who can essentially just tell them, it's like, hey, what is this? If I just list for you, AI at this point can either supplement a human diagnosis. In some cases, it can do a lot of the work. Like right now, it's superior to a human radiologist in identifying tumors on a radiology film, as an example, because software can see shades of gray that humans can't. It can reference millions of data points, whereas even the most experienced human can only reference hundreds or thousands. So we need to try and make that kind of resource available to more Americans by saying, look, and this is the thing that infuriates me, is you go to the doctors and say, hey, there aren't enough doctors. How about we let nurse practitioners see patients in rural areas that don't have doctors? What do you think the medical lobby says to that? No. It's got to be a doctor. And to me, that is so messed up. So the choices are, it's like, look, you either got to increase the supply, and we will put money to work to help you do that, and we have to loosen up the licensing restrictions. We have to make it too. There's another trap in the doctor world that you'll see, is that you have state-by-state licensing. And the state-by-state licensing makes very, very little sense. Because frankly, if you're a doctor qualified in Iowa, you could probably see human patients in Minnesota and not, like, human anatomy is more or less the same across state lines, you know? It's not like Minnesotans all of a sudden have gills, you know what I mean? Like, but so why is it state by state? Again, does the lobbyist trying to like protect various businesses? You lower the licensing requirements, you make medical training more portable, you increase the supply, you try and get the cost down, you forgive the debt, and then you hopefully provide new ways for people getting care. So that this is obviously, you know, I'm passionate about this because I see just how deep the inefficiencies are, because so many of my friends went through the incredibly expensive process of becoming a doctor. And there's an element of this too that I think, and this is just something, it's like you feel like you have absolutely no choice because we've saddled you with life-changing debt. And I don't think that is necessarily the right way to incentivize doctors to do the right thing. It's a little bit like I was talking about small business owners. It's like, we're going to ask you to do the right thing, but we're going to actually have all your incentives be in the other direction. It's the same with doctors. It's like, we want you to return to your community and see, you know, poor people who need a family doctor, but we're going to actually make it much, much easier for you to go, like, try and become an orthopedic surgeon in, like, in New York City.
Very good. You just mentioned small business owners, and I just want to make a comment to people that are listening online that we are holding this in a small business and in a coffee shop where the barista is working really hard over there. So if you're hearing some noises that don't sound like you're in someone's living room, that's why. And we're very happy that Mike Draper let us use his store today for this event. And you're up.
Hi, I'm Aubrey Massman. Can you hear me?
Yep.
I'm also a medical student. I'm in my third year, starting on clinical rotation, so finally getting out into the world and seeing patients here in Iowa. And I'd like to ask about mental health, because I've noticed that that's a pretty big disparity, especially here in Iowa. We are ranked as the last in the country on inpatient psychiatric units per capita. And so I'd like to ask, first of all, I know you talk about expanding access to mental health, but how would you incentivize bolstering that workforce? Because I know a big issue here is a lack of supply. Yeah. And then you also have mentioned in the past supplementing that with AI, and I wonder, how would you do that in such a delicate field?
My brother is a psychology professor, so I have also very strong feelings about the fact that we're in the midst of a mental health crisis in this country that is going unaddressed. And one of the big principles is that mental health is health, essentially. Mm-hmm. And there have been some efforts to integrate mental health with health treatment that people seek. So if you imagine someone showing up to a hospital with a range of issues, let's call them drug addiction, obesity, depression. Like, a lot of these things obviously have psychological tie-ins. And so there was one facility it was like an incredible woman who started a facility that if you go in for a checkup or a physical or health problem, they just refer you to the therapist down the hall. and then the therapist then sees you too. And they produced much, much better health outcomes than a standalone hospital or facility. Now, that does not address what you're saying, which is there's this massive shortage of psychologists and psychiatrists and therapists and providers. And again, to me, there's no shortage of young people who want those roles. We're just making it very, very hard and expensive for someone to actually get those roles. Part of it is, again, if we shift the measurements of our economic progress to be mental health, And then you look around and be like, we really are not investing very much in the mental health of people in a particular area. And then over time, the government ought to fill those gaps. It would look up and say, well, literally it's the government's job to make us stronger and healthier. And so then if you're looking up and saying, it's like, well, people are unhealthy in that area because guess what? There are no psychologists, no therapists, no counselors, no psychiatrists. Then the government would say, well, let's change that. And then you would put massive resources to work, hopefully training Iowans. One of the things I know for a fact is that people want to help other people. I know so many young people who would love to enter this sort of field, but we've just made the training really difficult to access, expensive. We've set up, in my mind, very artificial barriers around test scores. It's like you need to be a freaking genius to get certain degrees, and it's totally unnecessary. It's like there are a lot of people that would be excellent in roles helping other people. We need to open up the training so that people can actually be in that sort of position.
And when we're talking about mental health, a lot of people, where they end up is in our jails and prison system.
Very much so.
So I think that's a big, big issue when it comes to that. And what can we do about that? I mean, we used to have facilities in Iowa in every county that people could go to, and now they're like, 3 in the state, maybe? I mean,
it's all tied together. I mean, we have this incredibly punitive system of mass incarceration. And if someone is mentally ill and struggling and then commits something criminal, then we just throw them in jail, and things in many cases just get worse in jail.
right.
Compounding that, we have private prisons, so their economic incentives are actually to treat you fairly poorly because then they can save money, and then if you come back, they make more money. That's a ghastly set of incentives. I'm all, as you can, I think you can tell, I'm about trying to get the right incentives in place so that we do the right thing. It's one of my great frustrations is that essentially right now the incentives in American life are generally corrupt, where they're all about maximizing the bottom line in every direction. And the bottom line and the human bottom line are diverging in very important ways. So if you have a private prison and you're trying to be maximally profitable, you're going to end up cutting corners on treatment. You're not going to care about recidivism at all. And so what you have to do is you have to, in my mind, get rid of private prisons, because this is not an area where profit motivation makes any sense. And then you would pay jails based upon success measurements like successful rehabilitation and reintegration into society and treatment of mental illnesses. And you know what's going to help a lot is if when they come out, they're getting $1,000 a month. Because right now when they come out, there's no job waiting for many of them. With $1,000 a month, then people will be happy to see them. They'll show up at home and be like, hey, I'm out. And they'll be like, great, you brought a dividend with you. I mean, it's unfortunate, but that actually probably changed the way people react.
Good.
Hi, Andrew. My name is Ryan Morris Jeter. I live here in Des Moines. One of the things that's captivated myself and my family about your campaign is your want and our need to change the way that we measure what a successful society and a successful economy look like. And I also really love the fact that you want to use PowerPoint decks to do some of this. I work for a large corporation. I see a lot of PowerPoint decks. Some are better, some are worse, but really they all get the information across fairly simply. They're easy to understand. So I guess I have 2 questions. First question would be, can you promise the American people that you won't use a Sharpie to adjust any of those presentations?
Yes, thumbs up.
Awesome. And second question would be, how do you plan to implement some of these changes in the way we measure? You've answered some of them before in regards to GDP, but are you looking for a cumulative number, or are you going to put together a PowerPoint presentation with different numbers that show? You have a way in which you want to show us, what, I guess, score. How do we score this?
Well, thank you, and you see the vision very clearly. So GDP is leading us off a cliff. It's at record highs, but also record highs, suicides, drug overdoses, anxiety, stress. It's the opposite of what we need. Now, I'm happy to say we have measurements for things like life expectancy, obviously. We have measurements, though they're not what they should be, for things like mental health. drug overdose rates and deaths of despair. Childhood success rates to some degree. To some degree, we have environmental quality measurements, like you have some limited sense of how clean our air and water are. And I'm happy to say that me going down the street to the Bureau of Economic Analysis and saying, guess what, these are the new measurements, and instead of reporting GDP every quarter, you're going to report these things, and then using a PowerPoint and saying to the American people, all right, here's our current life expectancy, 78.4. Been going down for 3 years. That is not normal. That has not happened in 100 years. So what are the moves we can make quickly that will help reverse this decline in life expectancy? And right now, the two big problems for our life expectancy are suicides and drug overdoses. So then you would say, well, if 8 Americans are dying of drugs every hour, that is horrifying and way too high. So then how are we going to get those numbers down in a short period of time? So I would present the composite number, like the American scorecard that you then get used to, and say, oh, the American scorecard is getting better or worse. And then there'd be individual measurements for deaths of despair, for life expectancy, for mental health. And then after we got good at it, you could actually introduce measurements for things like socioeconomic mobility and fairness, for cultural dynamism. Like you could actually start being like, hey, like, you know, if there's like a, let's say, for example, you know, a set of artists do something that beautified Des Moines, it's like, that actually, like, you know, like gets a tick somewhere. That's after you get very, very sophisticated. But I'm happy to say the basic measurements are essentially already there. And most of them, the American people would understand immediately. If I say life expectancy, you get it. If I say drug overdoses, everyone gets it, unfortunately. And so over time, you could start, this is just what any, in my mind, effective organization would do, is that you look at what the real problems are, and then you start trying to attack them, but you have to know what the baseline is. But thank you for seeing the vision. This is the vision of the human-centered economy, or human capitalism for short.
We see the vision, for sure.
Thank you, man. So great. Hey, now this, do you see the vision? I'm not supposed to look at you.
Okay, so I think I'm the last medical student in the room. My name is Alex. I am a second-year medical student here in Des Moines, and my question is kind of centered on abortion. So as we all know, women's reproductive rights are currently under attack all across the country. Specifically, I think most notably by limiting access to safe and competent abortion services.
Yep.
There's like women are, and certainly we talk about those deserts of like primary healthcare deserts, having to drive like hours and hours with mandatory waiting periods. And for me personally, I am hoping to specialize in reproductive medicine. And so this is a particularly important kind of trend that I've been paying attention to. What is your plan specifically to address these attacks on women's rights within your first 100 days in office?
So first, we have to protect Roe v. Wade. And again, I'd be open to adding Supreme Court justices if that's what it took. Ideally, we would also codify Roe v. Wade into federal law. Then the next thing is to bolster the resources available for Planned Parenthood and women's reproductive rights centers around the country. Because to me, these centers are, one, they're important for health, like women's health is health. But two, there's like a real equity issue because, as you're saying, that if you live in a poor area, then it's much, much harder. And that, to me, is not right and unjust. So we need to put resources to work to try and provide equity in that. And as you know, my flagship proposal is to give everyone $1,000 a month, which would help balance the inequities between communities very, very quickly. The main thing, though, is to try and reverse these attacks on women's reproductive rights and, in practical terms, get more resources to centers that can help provide this care.
Would you add any kind of like legislation or push for legislation to kind of like downregulate trap laws, the targeted regulation of abortion providers? A lot of those kind of like legislation that are kind of insidious and they get snuck in to make it harder for doctors and physicians that are passionate about it and able to give abortions. That makes it, there's gag rules, there's mandatory waiting periods like I mentioned. Do you have plans to kind of push for legislation that would basically beat those laws?
Yeah, to me, there should be nothing standing between certainly a doctor doing what he or she thinks is right for the patient, and there should be nothing standing between the patient, the expectant mom in this case, from pursuing that care. To me, we have to respect women's rights to choose, and that includes not just throwing up barriers in the way.
Hi, my name is Roshan Wilder, and I guess I'm in a very unique position because I am a social worker here at Des Moines, as I care for my special needs daughter. I work for a small business where I can't afford health insurance. Uniquely enough, ironically enough, the reason why I'm here is because my daughter lost her medication. And my question to you has direct links to Big Farm. One of her medications, so she lost a month's supply of medication. One of the scripts, just one, would cost me, on GoodRx, $789.
Oh my gosh. Yeah.
And that's the generic version. But that's one of the 4 pills that she has to take. In addition to healthcare being as expensive as it is for small businesses, and the fact that I am a product of that small business. We also have pre-existing conditions, but we still also have Big Farm in this industry that is just lucrative and is ridiculous. What would you do about that?
Well, first, thank you for everything you do. One of my boys is autistic, and to me, being neurologically atypical is the new normal. But I understand what parents do. I am one, so thank you. Why is it that drug prices only go in one direction? Why is it that they only go up? And so I've got a 4-point plan to reverse the increase in drug prices that I think you'll see will work very quickly. So if you move to a public option, then you're negotiating on behalf of the American people. You all are not going to believe this. Right now, the government is not allowed to negotiate for lower drug prices on behalf of the American people because the drug lobby is so powerful. They made it so you can't even negotiate. So that's number one, negotiate for lower prices. Number two is you adopt international standards for the cost of drugs and apply it to American drug companies. You're also not going to believe this. American drug companies routinely charge us 2, 3, 4 times as much as they charge for the same drugs in other countries. And in many cases, we actually subsidize the development of that drug through the government. So what we'll say is we'll have a pricing schedule and say, look, you cannot charge the American people more than you're charging other people, like based on a cost average. Number 3, we have the ability to forcibly license your drug if you do not abide by number 2. And then number 4, we have our own manufacturing facilities where we can actually manufacture the drug under our own license. Now that's like the hammer. If you have your own government facility and you can force license, do you think that drug companies would then keep their prices under control if they saw that that was actually the outcome if they gouge us? This is the only way for it to work because the drug companies right now, all of their incentives are to stick it to us and profit to the highest ability they can. And you wind up in situations like yours where you can't afford the drugs that you need. And they don't care. Like their incentives are all to just try and squeeze money out of us. The healthcare industry is probably the clearest example of where just the market has run amok, and our government is way behind the curve and held captive by the lobbyists. Our government right now is not our government in many respects. So this is going to sound a little bit far afield, but I think it's important. I've now been running for president for a number of months, and I see now that people and money are in 2 different places. Like, if 1,000 Iowans or 10,000 Iowans vote for you, that's tremendous. But then you have all the money coming from the corporates. Like, the drug industry spends tens, hundreds of millions of dollars on lobbying. And if you're a politician, you naturally are responsive to the money because you can count the money, you can see it in your bank account, and their food is nicer. Like the people are better dressed, and some of them can give you a job after. So if you're a legislator, your incentives naturally just go towards the money. Now the way that we overcome this and make it so that the drug companies can't just stick it to us at every turn is you give every American adult 100 democracy dollars that we can give to any candidate or campaign that we want. This would wash out the lobbyist money by a factor of 7 to 1 or 8 to 1. And so then if you get enough people behind you saying, like, let's say President Yang, and you should know that I'm right now fueled entirely by small dollar donations. The average donation to my campaign is only like $25 online. So my fans are even cheaper than Bernie's. No corporate money to answer to. And so if I go to the legislature and say, hey guys, guess what? Drug companies are just running amok. We have this 4-point plan to bring their prices under control. Then you have to get the legislators to go against their corporate masters. And the only way for them to do that is if they see that siding with the people is actually good for them professionally. Again, it's an incentives thing. It's like, how are they going to do the right thing if we have the money? That's like the only way. So this is a very long-winded way of saying that I'm determined to make it so that drug companies work for us rather than having us be subject to their arbitrary price increases.
Hi, Andrew. My name is Michael Clinkscales, and I am uniquely privileged to come from a family who has been given a heart for mental health, and more specifically in the last 5 to 10 years, drug addiction. I have had the opportunity to work at the Polk County Jail with an alternative sentencing program, as well as my dad, who has worked in that alternative sentencing program for people with non-violent drug-based offenses. Well, my question is how you would deal with the recidivism rates for these men and women, and looking at addiction, what your plan is moving forward for these people whose lives have been upturned either by big pharmaceutical companies that have effectively made them addicted,
Yep.
or just through the way that life has fallen upon them.
Congratulations for all you and your family have done. Why do we have an opiate epidemic in this country? Because Purdue Pharma distributed millions of OxyContin prescriptions and made billions of dollars, tens of billions of dollars. They got fined $500 or $600 million, which sounds like a lot until you realize they made $30 billion. They got a 2% fine. They're some of the richest people in the country. And what they did is they distributed millions of OxyContin prescriptions to Americans. There was one point where there were more Oxy prescriptions than human beings in the state of Ohio. I mean, who could look at that and say, yeah, that's appropriate? I mean, obviously, it doesn't make any sense. They marketed it as a non-addictive wonder drug. It was super addictive. The Oxy addiction has spiraled now into heroin and fentanyl and other opiates that are cheaper, easier to get. 8 Americans dying every hour, countless others' lives impacted or, in some cases ruined. Very, very hard to shake the addiction. Rehab works unevenly. You have to go in several times, and sometimes it never works. And there's a punitive approach we have in this country to drug addiction where we're like, well, your fault, and we're criminalizing it. If anything, we should have criminalized the distribution that came out from the Sackler family and Purdue Pharma. I'm happy to say that it looks like Purdue Pharma is going to be declaring bankruptcy, but it's years and years too late. I mean, these people are already, again, addicted and have their lives ruined. This was blood money to the tune of tens of billions of dollars. So if you're the federal government and you say, okay, we were negligent or delinquent in protecting the American people from this addiction plague, which is factual, then how do you treat it in an effective way? First, you try and put money to work, but money doesn't do the trick in a lot of cases because it's a human problem. Money shouldn't be the obstacle. You have to spend money, but it doesn't necessarily undo it. One thing we can do that would help is if we humanize the approach to addiction. So I would decriminalize all opiates for personal use, including heroin. So if you're an addict and you get caught using, you do not go to jail. You get referred to treatment and counseling. And what this would do is this would increase the likelihood that addicts would seek help. Because right now, if you're addicted to fentanyl, I was here in Iowa, and a high school student said to me, he said, my high school classmates have fentanyl patches on their shoulders and they're addicted. What can we do to help? And you know that kid is never going to go get help because fentanyl is illegal. And he didn't have a criminal record. And so if, as president, I say, look, the punitive approach to drug addiction, a lot of people never come back from, it's like, there was an activist who said, you can't come back from rock bottom if rock bottom is death. And so instead of saying to people that, oh, you're going to pull yourself up, we have to say, look, this is a massive disease of capitalism that we have helped, at a minimum, witness and maximally helped inflict on the American people. So we need to own it and say, look, if you're an addict, this is not on you solely. This is an us problem. We need to decriminalize use. I mean, if you're a dealer, then you're a criminal, and we will punish you. When other countries have gone down this direction with safe consumption sites and safe injection sites, they have seen massive decreases in not just overdoses, but abuse. And I talked to a paramedic who said that he will save and inject with Narcan an opiate addict one day, then he'll be back trying to save their lives again the next week. Like we need to get that person to a safe consumption site and say, look, we get it, you're an addict. Let's get you someplace where someone can actually monitor your consumption activities instead of pretending that after you get out of the hospital, you're going to go home and shake it yourself, because you won't.
And what about alternative forms of medication for pain, like legalized marijuana or CBD oil?
I mean, as you can tell, if I'm open and very enthusiastic for legalizing opiates, I'm enthusiastic for legalizing cannabis and marijuana and getting it off the controlled substance list, because it's a much safer means of pain relief for many Americans. So I would legalize it nationally, and then I would pardon everyone who's in jail for a nonviolent marijuana-related offense on April 20th, 2021, and I would high-five them all on the way out of prison.
So we have about a couple minutes left.
Think about that, man. Being president, that would be the funnest power, is the pardon power. It's why are we pardoning asshole millionaires and billionaires? We should be pardoning the random citizen who's in jail for a crime that's not even illegal in a lot of the country. And we know a lot of those people in jail. I mean, it's because of a racist application of our of our drug laws, because people who are in jail for marijuana-related offenses, I have a feeling we know most of them are black. You're not going to find a lot of white suburban kids who are in jail for pot. That's not really happening.
So we have time for one more quick question, and then we'd like to let you have a couple minutes to wrap up. So,
thank you. My name is Will, and I'm a student here at Drake University, right here in Des Moines. My question is about something that's been in the news recently concerning e-cigarettes and vaping. I have a younger sister who's in high school, and a lot of her friends are involved in, juuling and things like that in such a way where it's almost like a game, or it's like a joke to them. And I had the chance to work for Senator Durbin, my home senator, last summer, and a lot of his work is on banning these sorts of platforms, especially among teens and young kids. And my question is, I guess it's two, what do you think of the steps that have been taken so far, especially in the last week by the president, and how would a Yang administration focus on something like this?
It's a real problem, and we need to try and get in front of it. And it's an example of our government being asleep at the switch again, where you had these e-cigs and we weren't sure what their composition is. A lot of the problems that people are having with vaping and e-cigs is because there are impurities, and some of the things that are getting into people's system are not designed for that. We're not really checking it in that way. So we need to get in front of it as quickly as possible if it's going to. So there's something between you can be legally but regulated. There are a lot of rules around tobacco. Tobacco is legal, but you can't advertise, tobacco to kids, or have it sold within school grounds, or all this other stuff. We need to have a similar approach to e-cigs and vaping. And there's been this misconception that it's safe, it's a game, it doesn't smell, you're fine. But a lot of the manufacturers have not been super above board in terms of quality control. You know why? Because it would have cost them money. And then for us, the FDA has not been on top of quality control either. So this is yet another instance of our government acting a little bit too late. When you're dealing with something that is literally killing and injuring young people because of misconceptions about the product, you do need to regulate in a significant way.
well, I'd like to thank you for joining us
Thank you
today.
all. Thank you,
and
Sue.
I hope that you. I hope that you have learned something from some of the Iowans in the room, and I know you've given us a lot to talk about. And we really appreciate the time with Andrew Yang and NowThis.
I appreciate it too. Thank you all. Let's make history in
I need to
2020 Iowa.
thank our partners,
Who are our partners? Who are they, Sue? Go ahead. shout
Main
out.
Street Alliance and
Street Alliance.
Progress Iowa,
Progress Iowa. I love Progress Iowa.
and have a great rest of the day.
Thank you. Thank you all. Thank you. Appreciate you.
Whoop.
Stay seated. All right. I've been told by the powers that be.